Welcome back to the Get Foxy Show. Today's guest is the lovely Dr. Jessica Lubhan, MD. Jessica, thank you so much for taking the time out of your schedule to chat with us.
Thanks for having me.
You bet. Well, you are on this show. You were referred to me actually by another MD, Nancy Yen Shipley, who was just on not too long ago. And she said, you have got to have my friend Jessica on. She is so amazing. And she's also one of the 6%. So let's talk a little bit about that for a moment.
Okay.
What the 6% being 6% of women are in these heavily male-dominated professions. So what specifically is your profession?
So I am a urologist. So our specialty handles anything you think of that handles pee, from the kidneys, ureters, bladders, genitalia. So anything that urine touches is our specialty. And so traditionally, it's thought to be a very male-dominated specialty, just because it deals with male genitalia and things that are specific to men. But oftentimes, we often forget that women have the same issues. They have bladders and kidneys and genitalia as well. I think a lot of it is the gynecologists handle so much of what's usually traditionally considered the female parts. And so we are often considered the male versions of the female parts, but we cover both men and women, and we handle mostly anything involving the urinary tract.
Oh, that amazes me. It's like, well, duh, women too.
Yeah.
Well, how in the world did you decide that this was a specialty that you were going to get into?
I actually get asked that a lot. I'm sure Nancy gets asked that quite a bit too. Just because you do handle so many men and their very sensitive parts. And so the funny thing about medicine is I don't think anyone really knows what they're going to when they're going through training. Like, I didn't grow up aspiring to be a urologist. And I think most medical students going into med school don't think about urology. It's something that you're introduced to while you're going through your training. And, the funny part is I think everyone picks their specialty in different ways. And I think it really depends upon who inspires you, who your mentors are, who you get along with, that make the field really attractive. In my case, I love the people I was around. Yeah, I mean, you have to have a really certain quirky sense of humor to be able to do what I do. So it's really fun to be around that area. At the time I was in medical school, there are also, right now there aren't many women urologists, but when I was in medical school, there were even fewer female urologists. So I think there were only in the country at that time 400 board certified female urologists. And again, just like we had just talked about, women have these same issues that men do. We still get cancers and things involving the urinary tract. So I felt like there was a big need for women in this field, because there are a lot of women that just prefer to see women as well. But urology itself is a really interesting field. Besides the quirky, funny things that can happen in the field, we deal with big cancer operations. There's really small reconstructive surgeries. We see kids and young adults, the geriatric population. So we serve the entire spectrum. And so I feel like I could really dictate how I wanted my practice to be, what kind of procedures I wanted to do. Urology is also a field that really is at the forefront of adopting technologies. So we do a lot of really minimally invasive surgery. We do endoscopic surgeries, kind of like the colonoscopies, using cameras, you know, through your orifices. And we also, we're one of the first specialties that really adopted the robotic surgery. And I liked all of those things, and I thought those were really interesting. So from an intellectual standpoint, it was interesting. There are a lot of fields that play with technology, but I did feel that urology is a place where people got better. They weren't so sick. You do a heroic operation and they still are sick. This is a field where people get better, they feel better, and I find that really rewarding.
That's a nice feeling to know that, okay, I'm going to do the work, and yeah, my patient is going to survive and get better.
Yeah. and live to see the benefit of it.
Yeah.
So.
And actually, you know, probably say thank you. So what are some of the most common types of conditions that you see in your clinic?
I see incontinence. I see in both men and women. I see kidney stones. Cancers, kidney cancers, bladder cancers, prostate cancer, and all the functional things as well. You know, benign prostatic hypertrophy, so obstructive reasons. Men have issues peeing, neurogenic bladders. So there are a lot of different reasons that prevent or get in the way of the urine coming out. So I deal with all of those. So I'm a general, I do general urology, so just a little bit of everything.
Now, incontinence is definitely a big problem with a lot of women, especially in our society, I think.
Yeah.
Although, you know, I mean, it could be a worldwide thing too, but I mean, as far as being a traditional Chinese medicine practitioner and looking at our culture through that lens, I really think our society has some pretty good issues with this.
Yeah. Yeah, I mean, 1 in 3 women have issues. When you're over the age of 50, it's 1 in 2. So almost, you know, half of the women over the age 50, doesn't mean they have serious issues, but will experience leakage at some point. And it's just so common. And it's just shocking with something with something as common as it is, how little it's talked about. So.
It can be embarrassing.
It's very embarrassing. A lot of days I think we were just really poorly designed down there.
Well, you have taken steps to help women with this.
Right.
By creating the ONDRwear.
Mm-hmm.
Can you tell me a little bit more about that?
Yeah, absolutely. And so, you know, being in practice, what's interesting is you really, as a physician, you really hear the pain points of when people are having leakage, why they're actually seeking help. Usually by the time they see me, they're pretty bothered by their symptoms that, 1, they've acknowledged that they have an issue, and 2, they're ready to do something about it. And it's pretty devastating. People don't want to socialize. They don't want to leave the house. They're constantly worried about what kind of clothing they wear. They'll bring extra clothing with them. I've had patients who put, you know, when they exercise, they put a towel down because they're leaking so much. They're embarrassed about being intimate with their partners. You know, the interesting part I always find is the amount of bother somebody has no relationship with how severe their leakage is. And so someone could be in diapers all day long and not be bothered at all. And then some people who, you know, just decide they're not going to wear pads, or it's not bad enough that they need pads, but Just even the tiny bit of leakage is so embarrassing that they want surgery, medication, office procedures. And so you realize just how much pain that this is causing, and just how much societal embarrassment there is still about it. And so for me, especially, it was this population where the leakage was not as bad as as the impact to their life was way greater than their degree of leakage. Part of me just thought, like, wow, this is pretty wild that this woman is willing to go through all of this for something that doesn't seem that severe. And so it got me thinking, like, well, what is it about incontinence that is so embarrassing? Like, what is the part that gives them so much shame? And it's the smell, it's the feeling old, it's the, not being able to wear normal looking underwear, pads slip, they stink, they slide. And so there are all these pain points. And so I was thinking about this when I was pregnant with my first daughter. And so, I was trying to be environmentally friendly. I was looking for all these, these cloth diapering options for trying to, save the planet. But so, while I was thinking about diapering and hearing these stories, it just seemed like the technology was there. It's just never been designed in a way that has been socially acceptable for an adult. And so I thought, well, why can't you combine the two and just create something that looks beautiful, that works really well, and take at least one part of the pain point away. Fortunately, there's a lot of leakages that we can treat, we can make better, we can make go away, but there are some certain kinds of leakage that we can only improve, and so you can only get them to a certain extent, and so not all of it is fixable. So I needed an option for those kinds of, that population as well, or for the people who are not ready for something more severe or just want another option. And so if you can take the pain point, as from a physician standpoint, I also see all day long, I see cancers and some really, really terrible diseases. And so it just seems like if you could take the embarrassment, the stigma part away, that would help so many people avoid having to do so many more severe treatments.
You bet. Out of curiosity, Jessica, what causes incontinence?
Well, I would say the two most common kinds of incontinence that women experience are, the first kind is the stress incontinence. The ones that people get after they have a baby or after they've been pregnant. That's just, so I think of kind of the bladder sort of like a balloon with a tie on the end, right? And so if something has weakened the tie on the end, you're not gonna hold the urine back from there. So the stress incontinence is the structural weakness. You've lost the supporting structures of your pelvis. So from, chronic coughing, weight, baby weight, trauma of delivery, all these things, genetics. Somehow you've lost the supporting structures around your bladder, and so that tie is loose. So every time anything increased makes you cough, makes you push down, makes you grunt, that makes you leak a little bit of urine. And that, depending how loose your tie is, you can lose a little bit, you can lose your whole bladder of urine. The other kind of incontinence is not so much the structure of the balloon, but sorry, excuse me. but more that the balloon itself squeezes when you don't want it to squeeze. So structurally everything is fine, but the balloon itself is squeezing, and so that since you're not obstructed, you'll leak a little bit that way. That's the overactive bladder, the urge incontinence. That's the I need to go now. I stood up and suddenly I need to run to the bathroom, or I'm going to pee myself, that kind of leakage. And so, all the treatments targeted at the bladder. Some people have a little bit of both, mixed incontinence. And then I guess the last really common kind of leakage is what we call an overflow incontinence. And that's, instead of the balloon squeezing when you don't want it to squeeze, it has no squeeze at all. And so it keeps filling up until it's too full, and it's like a sink that overruns the top. You overflow the top. So I would say those are the three most common kinds of leakage that I see.
Okay. Man, that's definitely a difficult situation for the folks that are going through this. So your underwear brand helps these folks in those situations.
Right.
Is that correct? Right.
Well, the goal is to have something that you can use that it works like a pad, but doesn't look like a pad. You have the same functional ability. It absorbs, it's leak-proof, it doesn't slide around, and then it's washable and reusable, and it feels and still makes you feel normal. You can wear it under your exercise clothes, and there's no bulk, there's no sound to it. It looks normal when you change in the locker room. All these things that are the pain points of why people don't want to wear a pad. And some people just are sensitive, they have their skin sensitive to the chemicals or whatever the pad lining is made out of. And so they just, they get odor or infections or just irritation from that itself. So it just provides an alternative option to that.
Looking at your website and seeing the designs of this underwear, I mean, it looks just like any other. I would have, if I'd have seen people like that, I had no idea.
Yeah, when I designed it, I wanted, my thought was if I could create something that someone would want to wear anyway. I mean, these are kind of what I look for when I'm shopping for underwear. And so it would be nice to have something that you would want to wear even without the leak-proof capacity. And so I felt like it was first and foremost stylish, and then secondary, it also will catch anything else that could be coming out from there. So just because of the waterproofing technology that's on there, it holds period blood, sweat, discharge, anything that's coming out from there that is useful to have. My husband and I had issues with infertility, and so while going through those treatments, you get this incredible discharge that comes out of there. And so at that time I didn't have anything that didn't go through, and it ruined several pairs of pants because that was just sort of an unexpected side effect from all the medicines and things that you're putting, all the shots and medicines that you're going through. And so that stuff just doesn't come out of clothing well. So that's when you get that little tag from your dry cleaner that says this, we could not clean this without severe damage to your clothes.
So there's a high point right there in your book. can save people that sort of embarrassment from the
Yeah,
drive.
exactly. So yeah, and so I feel like there's so many places where I would have really found these useful. Even I think about when especially during training, you know, as a surgeon, sometimes, especially when you're in training or a subordinate, you can't just go pee when you want. You can't just go change, tampons or pads when you want to go. And so there will be times where you're in these very, very long operations. And so I would protect, I'd put in a tampon and a overnight pad just because I knew I wasn't going to be able to, I don't know. I didn't know that the next time I would be able to come out and change. And then the case is done. And someone would have to point out, wow, you got the patient's blood all over you. And you're like, uh-huh. Wish it were the patient's blood. Thanks. So all these times where it's just been super embarrassing. Felt like it would have been nice to have something a little bit more secure. So
how did you come about putting all these materials together? How did that sort of fuse to your product?
This is a long, windy story. If you want to go there, So you're absolutely right. So I have no experience in the textile world, and so it has been a slow slog. It probably took me 3 years to actually come up with, the actual product that's currently being sold. It started with actually just talking to the right people, just finding someone who's in the textile space on if I wanted to make an underwear, where do I go? What do I need? And someone will say, well, you need a pattern maker to get you, and you need somebody that can sew you a prototype. And so initially I went with there's some textile design firms that would help me source and design and pattern make and prototype. I went to trade shows to look through different kinds of materials. I talked to different companies. I try to find companies that just made a lot of different kinds of absorbent materials that you wouldn't even think to put in clothing. So I, tried it. There are all these really interesting fibers that haven't been actually milled into a fabric. So I started looking through these firms, trying to ask for samples. People are surprisingly helpful. If you ask for help, they will actually point you in the right direction. So you start with one person you say, hey, you have this looks really interesting. Can I get this in a cloth, or can I get this in a microfiber? And then they'll say yes or no, or oftentimes if they say no, but you should talk to this person who has this. And so you kind of keep going down that line until you find what you're looking for. And so I feel like this world is so interconnected now that, even if they don't have the right idea, they could lead you. They're a little bit more connected. They can lead you to the next person who can help you, and the next person. And then once you have that, there are people that say, okay, the next thing you need is, you need a factory. And then you talk to a factory and they'll say, do you have your tech pack? And it's like, I'll be right back with my tech pack, And so you kind of just, there's been a lot of Google searching. There's been a lot of cold calling. There's been a lot of rejection, a lot of silence, but slowly and surely. And I also did, just to learn about the fashion industry, did just some online programs, accelerators, just to, learn like what the options are. And
you've really become an entrepreneur along with being an MD.
It's been really interesting, really, really interesting. I mean, just the logistical challenges have been, quite eye-opening. You just don't realize what you need until the time comes. So, for instance, COVID has had a really large impact on, thrown in a lot of different logistical challenges. So initially, I tried to have my underwear produced in the U.S., but for my design, I needed to have certain technology that, long story short, really wasn't available here. And so I went abroad. So the one place abroad that would, I found a small factory willing to actually work with me. When we were initially starting our first production run, COVID hit, and so they had to shut down. And so there was no supply, like this, couldn't get the fabric. Then their factory shut down, and then they reopened, and then we shut down, and then just the logistical challenges of getting something imported into the US under these conditions. Just figuring all that stuff out was just quite the nightmare. But there's been a lot of Google involved, and a lot of moments where you think, oh, I think all the ducks are in a row, and you'll get an email that says, what are your tariff codes? And you're like, oh, tariff codes. Google, where do I find tariff codes? What customs bond do you want? Okay, what customs bond? What are my options? So it's just been, it's been really interesting. They don't give you a really good handbook. The one thing that has been nice about medicine is there's been a really clear path of what the next step is. You got to have this foundation of knowledge. You need to, to get licensed, you need to go to med school, do a residency, pass your boards. I mean, there's clear steps and expectations, but in the entrepreneurial world, anything goes pretty much. So
that is the truth. Well, I'm going to ask you the question I ask all my guests, Jessica. Okay. And that is, what does foxy and being foxy mean to you?
So for me, when I think about being foxy, I think about a woman who's, like what actually makes her really sexy. And, when you look at Victoria's Secret images and things that, while that is kind of visually sexy, that's not necessarily in real life what people find sexy. There's so many times when you say, like, when you read about historical women and their pictures are not too, they don't seem all that impressive, but the quote will be that there's this aura that is not captured by photographs. There's something about her that is not captured. And so I don't know what creates that aura, but I think it starts with a certain confidence that comes from within. There's a little something that's a bit of self-assurance that it is just hard to exude. But I feel like in order to have that, it has to start with some acceptance of who you are. And, in this world, as women especially, we're now supposed to, lean in, you got to be the perfect mom with your Pinterest parties, and you need to have, you need to be excelling in your career. You need to, you know, do everything, you know, but your house is clean and it's supposed to all look effortless. But I don't, you know, and everything is, you know, Instagrammable now. And I think that puts this unnecessary pressure on us, and we do it to ourselves. And I feel like that exacerbates things like incontinence, because how can you exude this perfect appearance, you know, you're stylish, and then how can you, and then you pee yourself. And so for me, what I think is really interesting is this is so common, and I think people talk to me about it all the time, obviously, because of what I do, but my friends will even send me pictures of their underwear, and, you know, when they work out, they'll be like, check out what I did today. Look, I really destroyed these. But I think, I mean, and it's hilarious and it's super fun for us, but I feel like if everyone talked about like that, it would be no big deal. It'd be like periods are now. And it really hurt. It's one of the most painful things I see is I see these really incredible women. They're incredible moms. They're incredible at their careers, and yet they feel ashamed of something like this. And sometimes, you know, sometimes it is from having a 10-pound baby. And I feel like that is, so when I had my first daughter, you know, I had to push for, you know, I don't know, I think I pushed actively for 10 hours or something. The whole time you know, the active pushing was 3 hours, but the whole labor was 24 hours. But the whole time I'm thinking, well, that's it. I'm going to be totally incontinent after this. You know, when my husband, you know, when we were about to leave the hospital, I asked my husband to just go out and buy the biggest, thickest pads for everything that was coming out down. I was like, there is so much coming out from down there. I don't know what's coming out. Just give me the biggest, heaviest pads, whatever you can find. And he thought he was being brilliant. And so he bought me Depends, and he came in with Depends, and he was like, look, this is such a good idea. You could just throw them away. And you know, at the time I looked and you know, you're emotional, you realize your stomach doesn't go down. And then you look at the Depends and you think, oh my God, you're right. I need Depends. And I just started crying. So those disappeared, and I never saw them again. But at the same time, I think back now, and it's like, you know, women, we've been through so much. Like, we've just carried this baby for 9 months. You literally just push this bowling ball out of you. And now we're like embarrassed about the aftermath. And I feel like that is just, that's such a shame we put that much pressure on women. I feel like these should be more like battle wounds, like you went to war and you came back stronger and you've got your scars to show for it. And yet it's, you know, no one's ashamed of that. It should be a point of pride to show what you've been through, rather than something you're embarrassed about. And so I do think that being foxy starts with that acceptance that, you know, things that are imperfect are perfectly fine. And I don't feel like that acceptance is a resignation that you're old, or I think it's being proud of what you've been through, what your body has carried through, and what it's produced. Now we have these two beautiful children, and I feel like that allows people to move on and keep doing other amazing things if you just, you know, start by accepting yourself. And I think that's what makes someone, you know, amazing.
Amen to that. Just by doing something like this, where we talk about it, we remove some of that stigma. And I think that's a beautiful thing. How can people find out more about your practice and your product?
So all of that is on my website, www.ONDRwear, and that's spelled ONDRwear.com. So it sounds like underwear, but on DR, like on doctor wear. And there are a lot of different options, and there's a lot of blogs. They're helpful for different kinds of stories about incontinence, and some general advice and tips that I think are helpful out there as well.
Excellent. Well, I will include all the links in the show notes. So listeners, this is more common than what we believe. So if this is something you've got going on, definitely check out Dr. Jessica's website. Jessica?
Oh, can I just add my Instagram
Totally.
as well? Oh, sorry. The Instagram and Twitter, Facebook at ONDRwear.
There we go. I'll include those links too.
Thank you.
Jessica, thank you so much for taking the time today. You are doing God's work.
Thank you so much for having me. I really appreciate it.
You bet.